old female patient. She came to my clinic. She was referred for shoulder joint injection, specifically steroids. On her first visit to my clinic, she was alert, conscious. She was on a wheelchair. She was about 65 kilograms and 165 centimeter height. This is not my patient, but this is a photo from the internet. I asked her to walk if she's able to walk because she was on a wheelchair. She confirmed that she can walk, but due to her old age, she's just on a wheelchair to help her. She walked a little bit from the door of my clinic to the examining table. All of a sudden, when reaching the last step, she collapsed down. So I started taking history from her. She was diabetic for about 20 years on insulin, and she was controlled. Cholecystectomy 6 years ago. Right breast cancer 10 years ago. And she had 2 left shoulder injections, steroid injections, with an interval of about 6 months. I asked to see her investigations. She had tons of investigations, more than 100 MRIs and EMGs, and more than 20 doctors she has been to. That was her cervical MRI. Do you have any comment on this cervical MRI? I would agree with you, there was nothing in her cervical MRI. So EMG revealed sensory neuropathy of the right ulnar nerve. This could be expected with patients that has been undergone breast removal. That was her site of dermatoma pain in the right side. But she was complaining of the left shoulder, not the right one. By examination, there was right arm lymphedema after the partial mastectomy with intact both sensory and motor compared to the left side. Astonishingly, there was weakness on the left side at C5-8. Level of weakness was about 3 to 4 from 5, so she couldn't resist my hand. There was sensory loss on the left side. Left side, there was no mastectomy. Sensory loss at C5-6, and numbness and paresthesia at 7-8-T1. Reflexes at the biceps. It was positive too. I couldn't do any further reflexes because she was in pain. That was the site of the sensory loss in the left side, and that was the side of paresthesia. So by examination, I started examining the shoulder. First clinical examination and followed by ultrasound examination. Left shoulder, there was pain and severe spasm over the infraspinatus. She had several MRIs telling me that she has left shoulder supraspinatus impingement. And that's why all the doctors she has been to, they have asked her to inject steroid, intraarticular steroids. Her MRI report, she had maybe 2 or 3 MRIs for the shoulder. They were stating left shoulder impingement. By ultrasound, as Dr. Adam has been mentioning, the dynamic ultrasound in the supraspinatus impingement is very powerful. There was no impingement, so she could easily do the abduction at full range of motion without any form of impingement, without any form of pain, smoothly. there was AC joint ballooning and subacromion subdeltoid bursitis.